Thank you, Mr. Chairman. Madam Secretary, you know Ohio well. I represent a district in Youngstown and Akron, and in the city of Youngstown, we have two healthcare systems. One of them is Forum Health, which employs approximately 4,000 people in the region, and it is now trying to emerge from bankruptcy. Youngstown has about a 15 or 16% unemployment rate. The city of Warren has one very similar, and adding 30 million new people to the system, and many in Ohio and in Western PA. I don't think now's a good time to see a hospital close down. And I was wondering if there's anything in your sights or from the administration that could help address this issue.
Well, my understanding is we solved one of the problems in terms of a payment stream that will continue during the discussion, which I think is important. And again, I think that the framework of having a payment system under the individuals who will seek hospital care in the future is a big step forward, and hospitals have really struggled. I also think that there were huge improvements made in the bill over the course of the discussion dealing with disproportionate share allocation, where originally there was a thought that it could disappear entirely, and I think that was recalculated appropriately based on the fact that there are huge disparities in terms of the patient load that's likely to hit various hospitals. But I think you're absolutely right that we need a robust healthcare delivery system, and it's something that we're going to be working with local communities, looking at ways that we can provide resources in this kind of bridge strategy to make sure they continue to provide services.
Well, in the meantime, until 2014,
Yeah.
when everyone comes in, I mean, hospitals like this could potentially close down. I know, and I think it's in Department of Agriculture, there are some loan guarantees, and maybe we can come up with some ways to help these hospitals refinance, because, you know, between now and then, a lot could happen, and the other hospital in town can't handle the influx that they could potentially receive.
Well, the community development block grant money, I think, which is in ag, and some other funding streams, I think we've got to be more creative about bringing other agencies in. The HHS really doesn't have either operational money or construction money with regard to hospitals, but I think having that dialogue with my cabinet colleagues is something that I'm going to pursue, because it's come up in a number of areas, and it's a very critical piece of the healthcare system. I think just like closing a school in a small town, you can't close a hospital or people won't stay in the community.
Right. So I look forward to working with you on that, because it's urban development, it's health, it's education, it's everything. So I appreciate that.